Blistering disease. Blistering disease include the pemphigus and the bullous pemphigoid. Pemphigus. Pemphigus is an uncommon intraepidermal blistering disease occurring on a skin and mucous membrane. It is caused by the autoantibodies to adhesion molecules expressed in the skin and the mucous membrane. The cause is unknown. The bulla appear spontaneously and are tender and painful when they rupture. Drug-induced pemphigus from the penicillamine, captopril, and other has been reported. There are several forms of the pemphigus, include pemphigus vulgaris, pemphigus vegetans, pemphigus foliaceus, pemphigus erythematus. All forms may occur at any age, but commonly in the middle age. The vulgaris form begins in the mouth over 50% of the case. Clinical features. Signs and symptoms include pemphigus is characterized by the insidious onset of the flaccid bulla, crust, and the erosions in the corpse or waves. In pemphigus vulgaris, lesions often appear first on the oral mucous membrane. This rapidly become erosive. The scalp is the another site of the early involvement. Rubbing a cotton swab or a finger laterally on the surface of the uninvolved skin may cause the easy separation of the epidermis, which is also known as Nikolsky sign. Laboratory finding. The diagnosis is made by the light microscopy and by direct or indirect immunofluorescence microscopy. Autoantibodies to the intercellular adhesion molecule can be detected with the ELISA and have been replaced use of the indirect immunofluorescence. Differential diagnosis includes blistering disease, include erythema multiforme, drug eruptions, bullous impetigo, contact dermatitis herpetiform, and bullous pemphigoid. Treatment. General measures. When the disease is severe, hospitalize the patient at a bed rest and provide antibiotic and intravenous feedings as indicated. Systemic measures include pemphigus requires systemic therapy as early in its course as possible. Initial therapy with the systemic corticosteroids, Prednisone 60 to 80 mg daily. In all but the most mild cases, are steroid-sparing agents added from the beginning. Since the course of disease is long and steroid-sparing agents take several weeks to exert their activity, azathioprine 100 to 200 mg daily and the mycophenolate mofetil 1 to 1.5 gram twice daily are used most frequently. Rituximab may be given in refractory cases. If this fails, the monthly intravenous immunoglobulins at 2 gram per kg intravenously over 3 to 4 days frequently is beneficial. Local measure. In patient with the limited disease, skin and mucous membrane lesions should be treated with the topical corticosteroids. Bullous pemphigoid. Bullous pemphigoid is a relatively benign pruritic disease characterized by the tense blister in the flexular area, usually remitting in the 5 or 6 years, with a course characterized by the exacerbation and remissions. Most affected persons are over the age of 60, and the men are affected twice as frequently as the women. The appearance of blister may be preceded by the urticarial or edematous lesions for a month. Oral lesions are present in about 1/3 of the affected patients. The disease may occur in various forms, including the localized, vesicular, vegetative, erythematous, and erythrodermic and nodular. Diagnosis is made by the biopsy and the direct immunofluorescence examinations. Light microscopy shows the subepidermal blisters with the direct immunofluorescence, immunoglobulin G and C3 found in the dermal epidermal junctions. If the patient has the mild disease, ultrapotent corticosteroid may be adequate. Prednisone at the dose of 0.75 mg per kg daily is often used to achieve the rapid control of the more widespread disease. Tetracycline or erythromycin 500 mg 3 times daily alone or combined with the nicotinamide, if tolerated, may control the disease in patients who cannot use corticosteroids. Dapsone is particularly effective in the mucous membrane pemphigoid. If these drugs are not effective, methotrexate 5 to 25 mg weekly or azathioprine 50 mg once to 3 times a daily or mycophenolate mofetil 1 gram twice daily may be used as a steroid sparing agent.